Hello, I'm your host, Neil Howard, here on Health Professional Radio. Thank you so much for joining us once again. Women with advanced ovarian cancer need improved education about available treatment options if faced with a cancer recurrence. Well, here to explain a little bit more about the latest in ovarian cancer research and treatment options for women with recurrent ovarian cancer is Dr. Heidi Godoy, and she's joined by Anna, who's going to share her personal experience with this disease. Welcome to the program, both Dr. Godoy and Anna. How are you both?
Great. Thank you for having us. Yes, thank you.
Great. Dr. Godoy, a brief background.
I grew up on Long Island. I then went to college at Cornell. I studied for 2 years at the National Institutes of Health, followed by going to medical school at UMD&J. And at that point, I realized I was interested in women's health and completed my residency at Georgetown, and then went on to do a fellowship in GYN oncology at Roswell Park in Buffalo, New York. Subsequently, I took a job as an attending at St. Peter's Hospital and at Vassar Brothers Hospital in Albany.
And Anna, a brief background, if you would.
Just a normal, everyday woman living my life. And then I had these really weird symptoms going on. I was bloated and I was tired, and I had this nagging backache that just wouldn't go away. And I called my gynecologist and made an appointment. And a few tests and a CT scan later, and we learned that I had stage 3 ovarian cancer, 3C, and that is like most women who are diagnosed with this disease.
Doctor, briefly, what is the traditional treatment for ovarian cancer? And then give us the latest treatment options that are available.
Well, for the historic treatment of ovary cancer, it was surgery followed by chemotherapy, followed by a relapsing, remitting course with an overall survival around 5 years.
5 years.
There are a few points in the treatment of ovarian cancer that have really changed how we treat our patients. One of them is maximum surgical debulking, where we would take patients from a large volume of tumor in their abdomen down to no gross residual disease. So we've evolved from a surgical perspective. We have then evolved from a chemotherapeutic standpoint in that we had started with medications that were not very effective, and we have come up with the most effective frontline therapy to be carboplatin and paclitaxel. We've delivered this both IV and also intraperitoneally straight into the abdominal cavity. We have now had our next advance in treatments with the development of PARP inhibitors, which is an oral medication that we're now using in the recurrent setting as a maintenance form of therapy, where patients, once they finish their like I call it big chemotherapy, they will go on a tablet or a pill once a day or twice a day until they recur again. So this watch and wait mentality, where we would give people chemo and then watch them and wait for them to recur, is no longer standard of care. So that is the big paradigm shift that we have really seen in the last 3 to 4 years in changing the landscape and the treatment options available for our patients with recurrent ovarian cancer.
What percentage of patients recur?
Sadly, I will tell you that there are about 220,000 women living with ovarian cancer. With 22,000 new cases every year, 85% of patients will recur. That is a staggering number. It's the 5th leading cause of death among women, and it is difficult to treat, and we're hoping to really change the outlook on patients being able to live a longer and healthier life with these types of medications.
Now, Anna, you say that you were diagnosed and you were at stage 3. Now, do I understand that you've learned that is kind of a typical diagnosis, or is early diagnosis more the norm? I know that's what we go for, but is your diagnosis typically when at the stage at which it's diagnosed?
Yes, unfortunately it is. 3C is the most common stage, and like others, we will recur. And once you recur, I think it's really important for women to educate themselves about the options available to them for a maintenance treatment. And I did my research as well, and I just encourage all ovarian cancer survivors to educate themselves and learn everything they can. And I'm really happy to be here on behalf of GSK as a patient ambassador to tell them this information.
Obviously, you're going through your life, as you said, just doing normal everyday things, and you've got this backache that won't go away, these other symptoms. Were there many misdiagnoses? And once you found out what your true diagnosis was, what do you tell other women who are dealing with, I'm sure, the fear and uncertainty of such a diagnosis?
Well, actually, unlike many stories that I hear, I actually was treated pretty much right away.
Okay.
I was sent right after my first appointment for tests, and 2 days later, we had the results. And unfortunately, like I said, many women, we have these seemingly everyday kind of aches and pains, backaches, we feel bloated or we're tired. And unfortunately, those are all of the, those are the only things we have to go by because we don't have a very reliable test for this disease.
Dr. Godoy, what can you tell women about talking with their physician about some of these seemingly everyday symptoms that Anna is talking about?
Well, I'm here to talk from the perspective of somebody representing GSK. I'm here to talk about Zejula, which is a PARP inhibitor used in the recurrent setting of ovarian cancer. So just like Anna, when she had her recurrence and was treated for her recurrent disease, she was placed on this medication to take every day, and she's been almost 2 years disease-free with minimal side effects. Now, I want to give you a fair and balanced presentation that there are side effects to this medication.
Okay.
Specifically, there's some hypertension, there's some nausea, vomiting, fatigue. It can affect your blood counts. But for the most part, it's well tolerated by our patients. And we would really recommend that you talk to your physician or your prescriber to see if you're a candidate for this type of therapy. Once again, the main thing I'd like to say is that watch and wait is no longer the standard of care for recurrent ovarian cancer. And really, for more information, you should go to zeula.com, zeula.com.
Thank you both for joining us here on Health Professional Radio. It's been a pleasure.
Thank you so much.
Thank you.